Hello, everyone, and welcome to Conducting a Contact Tracing Interview. My name is Wanda Jackson, and today I will be providing guidance around how to conduct this type of interview. So let's go ahead and get started on how to conduct contact tracing interviews. Let's talk about what you'll take away from today's session. By the end of this session, you'll be able to list the materials needed to conduct a contact tracing interview, as well as discuss and address contact concerns about being notified or interviewed. You'll also summarize the sequence of activities involved in conducting a contact tracing interview and explain the rationale for each section included in the contact tracing interview questionnaire. So let's go ahead and get started. Let's take a look at some key definitions that you will look at and see when you're conducting contact tracing interviews. You will see a case. This is a person who has tested positive for COVID 19, and you also may see the word or the acronym PUI. That means person under investigation. When you see the word close contact, that's someone who was within 6 feet of an infected person for at least 15 minutes during contact elicitation window, and that would be with or without a mask. Usually, we're referring to household or intimate partners. When we're talking about isolation, the way I remember how I'm to isolate, I equals infected. So separates infected people from others. When I think about quarantine, quarantine is questionable. I'm questioning whether I have the infection or not. So it separates individuals believed to be exposed who are not yet ill. So, what is a contact interview? I'm glad you asked. This is a conversation with a person who is a close contact of someone who tested positive for COVID 19, with the ultimate goal of detecting and isolating new cases as soon as possible. Now, when I look at this definition, I really look at the terms detecting and isolating. That's what really stands out for me because that really is your mission as a contact tracer. And you're going to hear me say later, be clear on your mission. This is what I'm really referring to. Your role really enables and support close contacts being tested so that way we can determine who is or who is not infected. Some may be infected and not know it and could unknowingly spread the virus to others. But really reaching out to people who have been exposed to the coronavirus and may not know it is how we all work to protect the public's health. Well, what are the goals of a contact interview? First, we want to inform the contacts of their exposure to the virus. And so, with this, because the virus can cause mild symptoms, some may be completely asymptomatic, meaning without symptoms. Most may not consider the coronavirus, but actually think it's something else. So, we really want to assess the contact symptoms and their risk. And this can influence whether the contact is to self quarantine or to be isolated. We then want to link the contacts with symptoms to testing and care. And we want to do this immediately so people can learn of their status and receive appropriate care and take immediate precautions to avoid spread of infection. We then want to support quarantine and education of contacts. And this can be accomplished by asking about challenges they would encounter and then having the contact drive their care plan so that it's realistic and achievable for them. Finally, we want to provide instructions for next steps. The contact really maintains locus of control. That's empowerment. And we want our contacts to know that they are empowered. So, when we are calling our contacts, we are calling to listen. Every call is with one person who needs someone just to listen to them and to support them. And that's our goal. When we're talking about actually calling contacts who have been exposed to the coronavirus, we will have, in general, a list or order of things for the contact interview. The first is we're going to secure a list of contacts to call. And this comes from work that's generated by case investigators or case interviews that will then be sent to you. You would then prepare all of your materials and resources. So you would want to make sure that you have everything you need in advance of your call. So that way you're not scrambling at the last minute. I do have to say, failure to prepare can create an unnerving and difficult call. You would then just want to go ahead and make the call. I would suggest you identify a private setting to conduct the session and really be mindful of confidentiality. Introduce yourself. Be comfortable with your introduction and know how to refer to yourself. This will help you to set the tone for the call and really increase your confidence. You might consider developing a script in your own words so that your conversation will flow smoothly. Now, after confirming that you are speaking with the correct person, and you will know this based on the date of birth, you could say something like, "Hello, my name is Wanda, and I'm calling from the Anywhere Department of Public Health. Thank you so much for answering my call. The reason I'm calling you today is because you have been identified as a close contact to a person with confirmed coronavirus infection or COVID 19. I'm also calling to see how you're feeling and to offer some important information and then assist you with testing or other services you might need based on your answers to some of the questions I asked. This would take about 10 to 15 minutes or so. How are you feeling? And may I begin?" That's just one example of an introduction. Now, this can feel, I have to say, a little uncomfortable at first, but remember, in most cases, you can text the contact beforehand to let them know that you will be phoning them. So it's not like it's a cold call. You then would just want to go ahead and conduct the interview. And when you're conducting your interview, be polite, use a kind and a calm voice. Additionally, really becoming comfortable with the questionnaire or the script and the screens that you will be looking at as you electronically collect the information shared by the contacts is going to be very helpful. You want to enter any information you can about the contact in advance of the interview. For example, their name and their phone number, and then thank people appropriately throughout the session. Lastly, we want to make recommendations on testing and quarantine and social support services. So we may need to let them know where to go to have a test or how they can go about quarantine or self isolating themselves and offering other social support services. Now, I do want to say that you will be receiving training around the call center and the data entry apps your program will be using. But I mentioned earlier that you really want to have all resources available prior to your call. And here's what I'm referring to: have that call center app or web phone, have your interview questionnaire, have the data entry app, and have a list of contacts with phone numbers. So that way you can quickly enter the information and you will have good transitional phrases to help move you smoothly from one section to another that will allow your conversation to flow with your contact. Now, I mentioned earlier to be clear on your mission. When I say be clear on your mission, that's being clear in informing the contacts of their exposure and inquiring about symptoms and directing them to testing and support services. Really working with them around their isolation and quarantine plan. It's also going to be very important that you manage your personal opinions and biases. This will help really to avoid upsetting someone and shutting down the conversation. We're going to be working with many people who are from all walks of life and different from ourselves. So we really want to remain supportive and foster self-empowerment and always maintain respect for that contact. I like to acknowledge and hear the contact's reality. Although that may not be my reality, what is real for them? And I do have to say that when you're doing this type of work, always be prepared to address concerns about being notified or interviewed. And the number one thing is we always want to maintain the contact's confidentiality. Now, what are some typical concerns a contact might have about being notified of exposure or interviewed? Oftentimes, they might want to know, "Why are you calling me?" Or "How did you get my name?" Some may say, "What are you going to do with my information?" Or "Do I have to talk to you?" A lot of times people might say, I feel fine and I don't have any symptoms. These are all common concerns, and I want us to be prepared to address these concerns. If you get someone who's asking, why are you calling me? You can say, I'm calling all of those in our community who have the coronavirus or have come in contact with the virus. At this time, I'm reaching out to you because you have come in contact with the virus, and I would like to share some important information with you. What have you heard about COVID 19 or the coronavirus? That's just one example. How did you get my name? Well, part of my role with the health department is to work with those who have COVID 19. And someone you have come in contact with tested positive for the coronavirus, and they asked that I reach out to you. Our interest in contacting you is to make sure that you are healthy, that you get the information you need to protect yourself and others, and to offer testing and support services. So, just a couple of responses that we have that you can offer up to people when these concerns pop up. I also have to say that, in addition to those concerns that I mentioned, oftentimes people want to know, why do you need my date of birth? And I often tell people, I'm asking for your date of birth because I have some important and confidential medical information I need to discuss with you. And I want to make sure I'm giving this information to the correct person. Now, if you feel more comfortable providing just the month and the date, then that's fine. I will not be asking for any bank account, any Medicare or medical insurance numbers. And if anyone ever does ask you to provide this type of information, then you know the call is not legitimate. May I have your date of birth or birth month and date, please? And then I just proceed. People want to know in this day and time, is this a scam? Are you scamming me? And my response, and what I would like for you to say is, you know what? I think it's wise of you to be cautious. I want to assure you that this is not a scam. I will be not asking once again for any bank account, Medicare, or medical insurance numbers. And if anyone ever does ask you to provide this type of information, then you know the call is not legitimate. To verify that I am not a scammer, you can hang up and call me right back at 555-5555 and ask to speak to me. You can also Google my number, which actually checks back to the health department. I can also provide you with my supervisor or my COVID 19 team lead's phone number who can verify my identity. We really want to put people at ease and let them know why we're asking what we're asking. So be prepared to address these typical concerns that come up for folks.